Vomiting can cause dehydration to kick in much quicker than diarrhea. So I'm always slightly more worried when a dog has had ongoing vomiting. When it comes to causes of vomiting, well, it could just be a dietary indiscretion. There could be something stuck in their intestine or stomach, or it could be something like an organ problem such as kidney failure. So chronic vomiting always needs investigation. If a dog has vomited more than 2 or 3 times in a 24-hour period and they have accompanying symptoms such as seeming lethargic and off their food, then of course that definitely needs investigation.
Dogs that feel nauseous may go off their food and become anorexic. Initial measures to encourage eating include hand feeding, warming food to make it smell stronger, and trying a change of food to something deemed as tastier. But once again, any dog who is anorexic is at a high risk of becoming dehydrated, so refusal of just 1 day of food or a dog who is unwell with their anorexia requires a vet visit.
One cause of vomiting is if a dog has an obstruction, normally because they've eaten something like a bit of their toy or a tennis ball, for example. The sort of symptoms you might see with those dogs are vomiting even when water is being drunk and any food is being consumed. It all seems to come back up again. And the other thing to look out for is to check if they're actually passing any feces. And if they are they of normal size? Because when a dog has an obstruction, especially if it's a partial obstruction, we just see small, scanty, thin type feces coming out. With these dogs, as the condition continues, they'll actually vomit quite offensive material that resembles fecal matter. Of course, these dogs are an absolute surgical emergency, so make sure you get them checked out as soon as you are seeing any worrying signs.